We're different at Celebrate Primary Care because we don't practice factory medicine here. We focus on a personalized relationship, so when you call, we know who you are. We text with you, we email with you. When your labs come in, we call and talk about how we can make things better. We check on you after we prescribe a medication to make sure you're tolerating it okay. So we're really big into follow-up and having that relationship where you know us and we know you.
So a traditional practice, a provider may have 4,000 people on their panel, which is outrageous. But they have to do that because that's the demand. But in our practice, because we are concierge medicine, direct primary care, each provider limits their panel to 600 patients. We don't overbook our schedule, so it allows us time to sit with our patients. In a traditional practice, patients are scheduled every 15 minutes, sometimes more, sometimes double booked. Sometimes providers have 3 patients packed into a 15-minute. That's why you're ushered in and ushered out, or oftentimes you spend time, hours waiting in a waiting room. And that's not ever gonna happen in our practice. You're always gonna be, our front and center focus. And when you come in, we're gonna offer you coffee and water and, a little snack, and you're gonna come back and you're a part of our family and you're gonna feel comfortable. So while we do have a pretty waiting room, you're not gonna wait here. We do chronic disease management. We're very much into education and nutrition and prevention.
We can take care of most urgent care needs. Colds, ear infections, sinus infections, suturing. We can do suturing here in the office. We want the ER for the emergencies, not for the things that we can handle in a primary care setting.